Hi there. Today I'll talk about how medical imaging revolutionizes healthcare. Medical imaging involves creating visual representations of the interior of a body for analysis and intervention. Let's dive into the primary principles of medical imaging. First, radiation physics. X-rays and CT scans rely on radiation physics. X-rays pass through the body, absorbed at different rates by various tissues. Denser tissues like bone absorb more radiation and appear white, while softer tissues absorb less and appear darker. Next, magnetic resonance. MRI uses strong magnetic fields and radio waves to generate detailed images. The magnetic field aligns hydrogen atoms in the body, and radio frequency pulses disturb this alignment. As the atoms return to their original state, they emit signals to create images. Now, ultrasound physics. Ultrasound imaging uses high-frequency sound waves transmitted into the body. These waves bounce off tissues and organs, and the echoes are captured to create real-time images. This technique is particularly useful for viewing soft tissues and fluid-filled structures. Lastly, nuclear medicine. Techniques like PET and SPECT use radioactive tracers. These tracers emit gamma rays, creating images that visualize metabolic and physiological processes in the body. Now, let's talk about the importance of medical imaging. First, non-invasive diagnosis. Medical imaging evaluates internal structures without invasive procedures, reducing risk and discomfort for patients. For example, a CT scan can detect internal bleeding or tumors without exploratory surgery. Second, early detection of diseases. Imaging techniques like mammography are crucial for early cancer detection, often before symptoms appear. Early detection leads to timely treatment and better outcomes. Third, functional assessment. Some imaging techniques provide structural details and assess organ function. For instance, PET scans evaluate metabolic activity, aiding in diagnosing conditions like cancer. Fourth, guiding treatment. Imaging guides therapeutic interventions. During a biopsy, ultrasound or CT imaging accurately guides the needle. In cardiovascular medicine, angiography guides stent placement in blocked arteries. Fifth, monitoring disease progression. Medical imaging monitors disease progression and treatment effectiveness. MRI, for example, tracks changes in the brain and spinal cord in multiple sclerosis. Sixth, pre-surgical planning. Detailed imaging helps surgeons plan complex procedures by providing a clear map of the patient's anatomy. In brain surgery, MRI visualizes tumor locations relative to critical structures, minimizing damage. Now, some examples: X-rays and chest radiography. A chest X-ray assesses conditions like pneumonia, heart failure, or fractures, providing a quick overview of the chest cavity. CT scan for stroke diagnosis. In suspected stroke cases, a CT scan differentiates between ischemic and hemorrhagic strokes, determining appropriate treatment. MRI in neurology. MRI is the gold standard for imaging the brain and spinal cord, diagnosing conditions like brain tumors and multiple sclerosis. Ultrasound in obstetrics. Ultrasound monitors fetal development during pregnancy, detecting congenital anomalies and assessing fetal growth and health. PET scans in oncology. PET scans detect cancer, stage the disease, and monitor treatment response, detecting high metabolic activity in cancerous cells. In conclusion, medical imaging is a cornerstone of modern medicine. It provides essential insights into the structure and function of organs and tissues, enhancing diagnosis, guiding treatment, and monitoring outcomes. By combining different imaging modalities, healthcare providers obtain a comprehensive view of a patient's condition, leading to accurate diagnoses and effective treatments. Thanks for watching.